It's my pleasure to welcome Luca Michev. He's going to talk about evolving the surgical view digital visualization technologies. Thank you.
Dear colleagues, first I want to thank the organizers for having me here. So I'm going to talk about the evolving landscape of our surgical visualization. Let me see how to change. These are my financial disclosures, which are related to the presentation. So in the current format, we have two, I wouldn't say competing systems, but these are two options which we can use, active or passive. First, on the surgical field was the passive devices, meaning that we are using a passive 3D screen and polarized glasses. The other option is active glasses or active shutter technology, where you don't use polarizers, but you have shutters on the left and the right eye, which are continuously closing. So both of the systems, they have advantages and drawbacks. For example, the active systems can, in theory, provide more light and contrast, but the passive systems can create more natural image. And also in the active systems, there might be a visual fatigue for certain users, so have that in mind. Nowadays, the contemporary surgeon needs to know a lot of things about the image that he wants to use, compared to the days when we were using analog microscopes, and the things we need to know were the focal distance, the light source, and the level of magnification. Probably a little bit for the depth of field, but in order to create our most preferred image, we need to know some more technicalities when we enter the world of the digital visualization. Things like the pixel counts, dynamic range, resolution, frame rate, and latencies are important. The most important thing from this slide, in my opinion, is actually the dynamic range, because we don't often know what it is. The dynamic range means that a single pixel can create an image in the lowest light condition and the highest brightness condition. This is the window of the dynamic range, which will determine later on the resolution, the pixel count, and everything. So what are the supposed benefits with the digital visualization? Increased depth of field. There are analog methods of increasing the depth of field, and there are digital ones. So here we open a second door, which can somehow broaden the horizons of the physics behind the image. Increased display image manipulation. These are the digital filters and the imaging modalities that might allow us to see more than we see with the analog microscope. Greater magnification, improved illumination. In every imaging scenario, one thing is important, the camera and the sensor, but the second most important thing is actually the illumination source, because it will provide the colors and the reflections which the camera will catch. And last but not least, from clinical point of view, there is an option to reduce the light exposure because of the high sensitivity of the digital systems, hence to reduce the retinal phototoxicity that we might induce with different light sources. So this is the first example, our Ingenuity system. We have 2x1080p HDR sensors, meaning high dynamic range, and we have an OLED screen. This is a passive system, and the OLED screen is important because this is the screen with the highest contrast possible. So the recording is important because when we present our videos, we actually present the recording. In this case, it is 4K in 3D. This is the C-Luma. This is a dedicated digital microscope with two 4K sensors. And again, we are seeing 2 by 1080p in 3D, and we have a 4K recording, but in 2D. What I said about the digital ways to increase the depth of field, in the C-Luma there is a thing called digital focus stacking, which adds above the analog depth of field of the system, meaning that it will increase the depth of field of the microscope. Sizer TiVo 850 pursues the same goal, to increase the depth of field, to provide the ability to modify the colors of the image, because this is the way to create the digital filters. Like a Provo as we know it, and the future platform which is knocking on the door, Provo 8X, it will combine active and passive system, meaning that there will be a passive 3D screen and active 3D glasses which will be wear over the head. Bionics 1, one of the first called exo scopes, and it is based purely on active system, which is wear on the head. And what is interesting here is actually a recently patented imaging modality based on the infrared illumination. In terms of enhancing the fundus reflex in anterior segment surgery, it's obvious that it is beneficial. It remains to be seen if it will find any use in posterior segment surgery. So, after this short brief, I will just say that different technologies have different sensor resolutions, different depth of fields, and we need to navigate in between that in order to choose which one will fit best our expectations. So have in mind that higher resolutions on similar size sensors means smaller pixels. If the pixel is smaller, it will have lower dynamic range and vice versa. If the pixel is large, it will have high dynamic range. So ultimately, my advice would be if you can test all the systems and choose the preferred image for you. There are another things which are hidden between the lines, and these are the dynamic range limits. You can see the white image in the center. This is where the engineers call it imaging clipping. There is no image, it's simply white. And also color encoding difference. These are algorithms behind the image creation. So every manufacturer, they have their own signature of the image. Again, you use or choose the one that fits your imagination, let's say, for what you want to see in the microscope. These are options which we have already to live stream, broadcast, record, teach, share, things that engage all the staff in the OR and all the, let's say, followers or colleagues which you might have outside your OR in real time. So if you want, you can do a remote mentoring session or a remote observation with Ingenuity, GUVIS, and encoder and decoder, and with internet in every point of the world that there is internet, you can have near real-time interaction with the surgeon. This is an example of the so-called NGF filter, which is part of the digital filters of the Ingenuity system, where you can clearly see the vitreous body without any staining. So less phototoxicity because we don't use any dye. We can use lower amount of light, and again, we can modify the contrast in such manner that the vitreous from transparent can become visible. So this is, in my opinion, one of the, let's say, huge advantages of the digital visualization, because if you observe this eye through the oculars of your analog microscope, you might not see so well the vitreous body. This is another example where on the left side we have the so-called tissue detail filter. On the right side we have the so-called natural image. So I think you will agree that on the left side we have more contrast and highlights, which bring more details in our comprehension of the picture. I don't say that on the right image you don't see it well, but on the left image you see some more details. When it comes to illumination, you can change the illumination color, not only the temperature, but you can use the color because different tissues reflect different colors. For example, the fundus, we perceive the fundus as an orange tissue or red one or pale one, depending from if it's an emmetropic or if it's a myopic eye. And you might be amazed that actually the yellow color is the one that is most reflected. So if we change the color of the illumination and we apply a dedicated filter to that color, we might extract more imaging data from the area that we want to observe. For example, here you can see how changing the filters can change the image and the contrast perception. This is a blue filter, so later on we will go again on probably tissue detail mode. You see sudden increase of the contrast. You can stepwise increase the level of the contrast, and here you see what happens when we are using a yellow color illumination. So the image possibilities or the image modification possibilities are actually limitless, and they are related to the imagination of the surgeon, what he wants to see, or if he will see it a little bit better. Here you see another type of filter and another representation of this image. And last but not least, we have the opportunity to have functional imaging, not only structural perception. Functional imaging can show us where there is a perfusion or not. In this case, you see the intraoperative fluorescein angioscopy, because it is a dynamic visualization. It's not a there are not snapshots. Here, this is another phenomenon which is not often observed. We have a blood in the vessel, but there is no perfusion. We can see the embolus traveling through the vessel, and when we indent or apply a massage in the periphery, suddenly we see a reperfusion. These are phenomena which we not normally see with analog vision, so it's useful. And if we want to see even better the vitreous body, we might use fluoroscopic vitrectomy. So I think this is a limited field of visualization. So these are the future concepts in the visualization which I think are important. Increased depth of field, better resolution, higher magnification, improved illumination, and all the benefits of networking that we might want to have with digital visualization. Thank you.
Thank you, Luca.